group, and we asked ourselves this question: if you are offered a job in a private sector in Sudan or in a public hospital, which job would you take? And I have to announce that all of us agreed to take, or we've all agreed that we'll take the private job. And the reason for that, I mean, why are we going to go for the private health sector? Obviously, the good salary. And obviously, I mean, good salary means that you will be offered a better kind of equipment. Equipment will be more available, there will be better equipped or better trained personnel, and you feel well protected as a doctor. And I mean, in fairness, the working conditions in a private health sector in Sudan would probably be kind of similar to the working conditions which we have here in Ireland. And so I mean, that was what we found about why a private health job would, or a private job will attract us in Sudan. But then we found that there are many, many drawbacks to accepting a job in a private health sector. I mean, first of all, we would be dealing with a certain kind of people of a socioeconomic status, so we wouldn't be there for the wide public. And the other thing is that it's a service job with many, many or very long working hours, with no academic gain, no teaching, according to the people who's already done this job. And working there, we would have no impact on the general health because, again, we're just kind of channeled towards just a kind of a certain people. The other thing is that, I mean, private health sector in Sudan, it looks like at the moment it is kind of depriving national medical schools from the excellent and the good teachers which we had in our time, because obviously everyone was going to go and work into those hospitals. And one of the, another of the drawbacks of working in a private hospital in Sudan supposedly is that the conditions are uncertain, the jobs are uncertain. Any day the contract could be ended, so there is no job security. So we came up with recommendations to try and improve or protect the doctors working in private hospitals in Sudan, is probably to have a governing body or a supervision, so as to supervise all those hospitals, so as to protect the rights of the working doctors and nurses and other personnel. And again, the other thing would be quality assurance. There have to be statistics and records like mortality and statistics. And then the third recommendation would be to increase the insurance cover so that kind of a wider sector would benefit from that kind of care. Thank you.